My name is Valerie Nanono.
December 12th, 2023 is a day that both Valerie Nanono and her family will not forget in a hurry. The day marked the beginning of a new dawn. This is the day that efforts to unmute the world of a 13-year-old who deafened at 9 years started to yield results.
Although my hearing, it won't be exactly normal. It will be a bit different from normal hearing. I think that's also why I can't hear exactly. That's why I can't hear now, because I think it's different. That's why they said.
To Alego Olga Nanono's mother, the daughter was born a normal child, had a bright childhood with all the senses functional. However, in 2019, a dark cloud started hovering over Nanono's life as she suffered multiple illnesses, including leukemia and meningitis.
She started getting fevers, so we'd go to clinics, pharmacies, they would treat malaria, treat bacteria infection, typhoid, but it never ever went down. So we continued that way. That was in about 2019 in February. So this went on up to about June, when she now really deteriorated. Her palms were white, her mouth, her eyes, her feet, and she was very weak and losing appetite.
Since then, Valerie Nanono has been living in a muted world.
Should only hear bullets, slams of doors only. But when you call her Valerie, a car, she can't hear. Nothing. So it was another depression for the family.
Attempts to restore Nanono's hearing sense led the family to a number of medical facilities, both in Uganda and abroad. As fate would dictate, the family was later advised to seek treatment locally in Uganda, and this led them to Makerere University Hospital.
So we had to use a special technique that we've just started using. It just got approval from our government, our NIH, and got grants to do 25 patients. But since it's working so well, I thought I would use it here as well.
Despite the surgery being successful, Nanono has other two hurdles to jump before the Cochlear becomes fully useful to her.
It will take approximately a month or 3 to 4 weeks. The wound will have healed, and then we will attach a processor and then switch on the gadget. Okay, because this is a powered gadget, the electric batteries, and we switch on.
For this reason, the family appeals to well-wishers to come to their rescue.
We're trying to raise about $15,000.
These implants require a lot of supplies after. They need batteries, they need the wires. At times they get spoiled, children spoil them. So we keep in stock for them to keep coming and pick whatever they are picking.
As she waits for good Samaritans, Nanono will continue relying on the application that she has been using for her communication needs until the processor is fully fixed.
It's like you've been in a dark room forever and suddenly light is switched on. It's overwhelming. So you begin the stimulation of the nerve in rather a gradual way, so that the child or the individual gets to optimize the map within about 6 visits.
Cochlear implantation is usually the last resort for mostly children, after it's concluded that hearing aids or other interventions cannot be of help. Doc Kaskimono, UBC News.